Healthcare stocks were big winners this week, rising more than 3%. As we reported, most of that gain came yesterday when the Senate released a draft version of its own healthcare bill. And today, the draft was examined even further. As our Bertha Coombs reports now, winners and losers are emerging.
The Senate plan repeals individual and employer taxes, which funded Obamacare's expanded coverage. That benefits those with higher incomes. The plan leaves many of the Affordable Care Act's provisions in place, but with less generous funding. President Trump may have put it best.
It's a very complicated situation from the standpoint you do something that's good for one group but bad for another. It's a very, very narrow path.
Among the losers, adults who gained coverage under Medicaid expansion. The Senate plan would maintain funding through 2020, but then make states pick up more of the tab before ending it. Middle income earners making above 350% of federal poverty, about $41,000 for an individual this year, would get no premium tax credits after 2020. For older adults, that could mean a triple whammy. The Senate plan would allow insurers to charge them 5 times more than younger people. Right now, rates are capped at 3 times more. The bill also increases how much older people have to chip in for premiums, from 9.5% of their income to as much as 16%, while tax credits would be lower, indexed to the lowest tiered bronze plans rather than more generous mid-tier plans now. People with pre-existing conditions would not face a premium surcharge under the Senate plan, and some shut out would get a new benefit. Among the winners, the working poor would be eligible for tax credits, filling the gap for 2.6 million people who earn less than poverty level but weren't covered when their states chose not to expand Medicaid. Insurers would be able to offer younger adults lower premiums and skinnier plans in states that opt out of essential health benefits. And people with health savings accounts would be able to nearly double savings to $6,600 a year for individuals and $13,300 for families, more in line with high deductible costs. An industry spokeswoman says those measures will help the industry offer more affordable plans. Critics argue lower subsidies and the end of the mandate will cancel that out.
You're going to get a lot more people in these plans, but they're going to be a lot sicker, and you're going to have a lot fewer healthy people in the plan, so there'll be no balance. So you'll see very rapid increases.
The Congressional Budget Report estimated that the House plan would result in 23 million people being uninsured by 2026. The CBO score of the Senate bill is due Monday. Bertha Coombs, Nightly Business Report.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.